welcome to this evening's National Baptist Convention USA Incorporated Hope Health Webinar, Temple Care Matters. My name is Michael Miner, and I am the National Director of the National Baptist Convention USA Incorporated Hope Health Ministry, and we're so glad that you joined us on this evening. Look, we are streaming this live across our social media platforms, so feel free to share it in your networks. We also welcome everybody that's joined us here on Zoom. We're so glad that you've joined us this evening for what we hope will be another informative session of our TempleCare Matters webinar. All right, so let's open up our hearts and mind. Let's get ready to learn on this evening. We'll acknowledge our national leadership, our president, Dr. Boise Kimber, who was just in our area this past weekend, and he's doing a great job traveling across the country, sharing about his vision for our national convention. All right, what about this evening's webinar? In this evening's TempleCare Matters webinar, we'll have a special presentation on mental health with a special section about Black women. Of course, we'll share about March's suggested health services, including National Colorectal Cancer Awareness Month, National Nutrition Month, World Kidney Day, which is March 9th, Taste Test Sunday, that's the third Sunday, March 16th, and American Diabetes Association Diabetes Alert Day, which is March 28th. And because we're going to start the month early in April, we will also highlight an early April observance, World Health Day. All right, now, of course, this webinar is part of our continuing series of First Tuesday TempleCare Matters webinars. In each session, we'll delve into the 7 pillars of TempleCare Matters. All right, you know what we do first? It's time for our triple-demic update. Well, according to the CDC nationally, last month, flu rates, that's right, flu rates, spiked to the highest levels seen in at least 15 years. For the first time since the pandemic, flu is outpacing COVID-19 infections and hospitalization. The CDC has classified this flu season as having high severity across the United States. Now, why is this? There are a number of factors behind any severe season, including poor community protection from low immunization rates, low natural immunity, virus characteristics, vaccine effectiveness, and increased human contact via travel, office work, or school. Unfortunately, flu vaccination rates have declined since the COVID-19 pandemic. Wow. At the end of 2023-24 flu season, 9.2 million fewer doses were administered. Let me let that sink in. 9.2 million fewer doses were administered in pharmacies and doctors' offices compared with an average year before the pandemic. Now, what can we do now to help steer clear of the flu? A lot of things you can do to reduce your risk of getting or spreading the flu. Now, since the flu season is underway, it's not too late to get a flu vaccination. Even in season when the vaccine's effectiveness is low, it is likely to offer better protection compared with remaining unvaccinated. The tried and proven hand washing and disinfecting high traffic surfaces can help reduce contact with the flu virus. Taking efforts to avoid contact with sick people can also help, including wearing a mask when in healthcare facilities. Finally, remember, take care of yourself. Exercising, eating healthy, and getting sufficient sleep all help support a healthy immune system, which can help reduce chances of infection. Those who have been diagnosed with flu, do us a favor. If you're diagnosed with flu or experiencing flu-like symptoms, avoid contact with other people, especially in crowded spaces. Covering coughs and sneezes can help reduce the amount of virus that is in the spread. And of course, just stay home. All right, that's our update. Now, before we begin our health and services highlights, We'll share a bit about mental health with our A Better Way mental health and substance abuse lead, Sister Bettina Campbell. All right, Sister Bettina,
Good
welcome.
evening, Pastor.
All right.
I suppose I'm excited about being here tonight.
All right, good.
So good.
All right. Well, look, I'm gonna let you roll out. As she always says, she is an master social worker. Let me put that in there for free. All right. Now, I'm interested in this, Sister Bettina. What are some of the trends associated with mental health in our nation today?
Well, current trends in mental health include increased rates of mental illness, a lack of treatment, and a rise in the use of mental health services. According to the National Institutes of Mental Health, nearly 1 in 5 adults in the United States have mental illness. We're living with it. And in 2020, that meant 59.2 million people were living with mental health illnesses. And it's become more common throughout the United States, and especially among our young adults. Suicide is the second leading cause of death among adolescents.
Hmm.
So we are knowing that unfortunately, even though rates are increasing, and people are increasing using mental health services, is still a lot of people who are not receiving services, especially people in communities of color.
Okay. Well, since you said that, what are some special mental health concerns for Black women?
Well, Pastor, Black women catch it on all sides. So what we want to say is that we face a number of mental health concerns that include depression, anxiety, and trauma. And it's due to a variety of reasons. It's like social economic disadvantage, uh, partner intimate violence, gendered racism, and chronic stress and stigma. In addition, research says that Black women face, ironically enough, we are told that if we get an education, we'll have a better life. But studies are showing that, unfortunately, because of microaggression that Black women face when they do have these higher education and are in these higher jobs, they are experiencing more stress and more depression, and they're overwhelmed with physiological and psychological stress. And so, and additionally, we have that thing about Black women being superwoman,
Hmm.
and we think that we're supposed to do everything for everybody, and we're supposed to suppress our emotions. We're supposed to make sure that everybody's taken care of, and we don't express our feelings of vulnerability or dependence, and so that increases the mental health issues that we are dealing with, or likelihood of us facing mental health issues. And so we have to learn how not to prioritize taking care of others, but taking care of self. And we've been raised to believe that taking care of self is selfish, but it's okay to be selfish if you're protecting your mental health. So,
Well, I'll tell you something. I always thought my grandmother was Superwoman until she was. Okay.
well,
Well,
because of these issues, Black women are also more likely to experience maternal mental health. And so we want to make sure that, as compared to white women, but we only are half as likely to get treatment. So we want to make sure that we are taking care of our pregnant women.
all right. Well, let's talk about that. Uh, I know you can't tell us all, but can you give us 2 or 3 strategies that Black women can undertake to better their mental health?
Yes. First of all, again, we can prioritize self-care,
Mhm.
making sure that we are taking care of ourselves. We can participate in new promising interventions that are coming out that say mindfulness based stress reduction, of the loving kindness that include into practices, which are traditionally African practices, and making sure that we are setting boundaries and that we are seeking psychiatric care.
Hmm.
And maybe we want to, for Black women, maybe we want to seek those that have spiritually based to them, so that we know, and some kind of Afrocentric practice, so that we know that we are more likely to get a practitioner who really knows our issues and are concerned about our issues and will help us to reset ourselves.
Okay. Okay, what about the churches? What can our churches, especially our National Baptist Convention USA Incorporated churches, what can we do to strengthen Black women's mental health?
Well, that's a good question. I think that the churches can do a lot, because first of all, Black women, many Black women are spiritual, and we turn to the church first for help. So for our leaders, our pastors, and other Christian education leaders, getting themselves educated, talking about it from the pulpit, talking about it from the front of the church, saying that, you know, it's okay not to be okay. And if you're going through these issues, then come and see us, come talk to us, because we're going to create a community of care that's going to protect you and keep you safe, and help you with your issues, and help your family while you are going through this. We also want to make sure that we provide an investment. I mean, if an investment in resources, like having this webinar, so that our women and our families can know more about mental health, know what the signs, what the symptoms are, know where they can go for help, be encouraged to go to get the help that they need. We also want to make sure that we are just creating a spaces that are, because we are uniquely positioned to be able to go to help strong Black women feel like they don't have to be strong anymore, to help them to understand that it's okay to love themselves. It's okay to put themselves first. And so we can create a community of empathy and compassion in the church that will allow people to feel free talking about it. Because, you know, for many years, and still in some places, in some families, talking about mental illness has been taboo. So we can help them understand. The key thing that we can help them understand is that it's okay not to be okay. And mental illness is a disease or a sickness, just like any other illness that you get, and you have nothing to feel ashamed about, and that your church family loves you, and that we're going to support you regardless of what you're going through.
All right. Well, I see that we're already having some comments, but we'll delay that to our Q&A. We may take a couple in a second, but look, we've covered a lot. Is there anything else? Because I know we have to move on. But is there one more other thing, additional thing that you would like to share before we move on?
Yes, I want to remind people that of the National Suicide Hotline, which is a 24-hour hotline, and the number is 988. And it's also for veterans and for that are and active military people and their families. You dial the same number, 988, and when prompted, just press 1, because there are people that are waiting to help you. And again, if you are struggling with an illness and you have a church family, go to your church family, let them know what's going on, ask for help, and don't be ashamed or embarrassed to do it.
All right, look, I'll get a couple of questions here. We have one question popped up. It says, what if you're just depressed? Can you still call the 988, or you should only call 988 if you're looking to commit suicide?
Well, we don't know how. I think you should call 988 if you're depressed, because we don't know where that depression is going to lead. And if it's been for a long period of time, then you may want to call 988 to see what help there is available for you to go to in your area to get the treatments, get the service that you need. So they can also be a referral source, yes.
Okay. We understand that some health plans now will cover mental health treatment. What do you suggest if you have some people come in that are concerned about that? Should they inquire from the insurance companies, or is that an automatic thing? What can they do when it comes to using their benefits?
Well, I think that you should always you can always start out with your primary care and your insurance company to see who your insurance company will cover, because sometimes you think that they being referred from your primary care to a doctor that your insurance may not cover. So you need to make sure what your benefits are. and what they will cover. But also, I think it's important for churches leaders to sit down and talk to some local mental health professionals and have a list ready so that people can be referred to mental health people who are culturally competent, culturally sensitive to their needs and the issues that they face, because issues are different.
Okay. All right. Well, look, I know we have some more questions, but we're going to move on. We'll get some more in our Q&A section. As always, Sister Bettina, when we come on that we're going to be we get a lot of great information. We do appreciate your lifetime of service.
Thank you.
You're doing. All right. Thank you, Sister Bettina, but you'll be coming back to us. So keep those questions coming, and we'll get back to them. All right. Well, you know this is March, everybody. Guess what about March? In addition to the beginning of daylight saving time in spring, it is National Colorectal Cancer Awareness Month. Something about colorectal cancer: it's preventable, it's treatable, and it's beatable. We can save lives with prevention awareness. Colorectal cancer, sometime now they try to cut it short and call it CRC. I want you to understand this, everybody. It's the second deadliest cancer in the United States. Wow. Yes. Every March, National Colorectal Cancer Awareness Month spotlights this disease and inspires more people to get checked, starting at age 50 or younger if your family has a history of colorectal cancer. Two reasons why getting checked matters. First, screening can find the warning signs of colon and rectal cancer, letting doctors take action to prevent the disease. Secondly, screening can also find colorectal cancer early when treatment is most effective. 1 in 24 people will be diagnosed with colorectal cancer in their lifetime. But you can make a difference today. Learn about ways to build awareness, how to get support, and more. Tomorrow can't wait. Remember, colorectal cancer is preventable, treatable, and most importantly, beatable. All right? Now, we hear from our co-leads for our Hope Regional coordinators, Dr. Linda Copper and Pastor Bernard Montgomery, about the upcoming regional meetings. Welcome, Dr. Copper. Okay. I want to see if is Pastor Montgomery joining us? Okay. All right. Well, I guess some technical issues here. All right. So go ahead. So,
okay.
Great.
I'm here, Dr. Minor.
There he is. Okay.
All right. That's Pastor Montgomery. Okay. All right. So I understand. We'll start with you, Dr. Copper. You're the first not because you're a woman, but you are the first workshop coming up, conference coming up. Would you share the date and location of you all's meeting?
Yes, sir. Our Southwest Region 2 Regional Conference is actually this week, Friday, March 7th and Saturday, March 8th at the Morning Star Baptist Church. Dr. Theron Jackson is the pastor. It's located at 5340 Juella Avenue, Shreveport, Louisiana. We will be happy to have you come and share with us during this two-day conference.
All right. And of course, this session is open to anybody, but what are the states that Southwest Region 2 cover?
And the states we cover: Texas, Arkansas, Louisiana, and the Caribbean. So
all right.
anyone in these areas, we welcome you.
Okay. Well, now another big question is, why should people across the Southwest 2 region and beyond attend?
Because of the courses that we offer, the Hope training in person that is going to take place. We have all three of our trainings being offered. Health Ambassador will be taught, facilitated by Sister Rosie Jordan Maxson, Health Ministry Promoter by Sister Nettie Johnson, and Congregational Health Leader by me, Dr. Linda Carper. And then we also have some CLS courses. CLS Course 2072, Understanding the Impact of Our Culture, taught by Dr. Elliott, course, CLS course 2097, Rethinking Christian Education, taught by Pastor Rory Thompson, and then CLS course 7018, Women Embracing Grace, Transforming the Lives of Women, and that's taught by Dr. Cheryl Stewart. So we welcome you to come, and along with that, we have additional community resources that you will be able to connect with.
All right, and I see that I caught the last one that the course 2097 is being offered, and your pastor is teaching that, so I'm bearing that in mind. So, Pastor Montgomery, you heard that for yourself. That's a little inside joke for us here. Okay, look, Dr. Cobb, how can people register, and what is the registration fee?
And the registration fee is $50. You can actually register by clicking it's a QR code on the registration or the cover page located on the Hope NBC website. So if you would please scan that QR code, it'll take you right to the registration page. And if that does not work for you, please email info@hopenbc.com and we will get you the link. And the registration fee is $50.
Okay. All right. Thank you, Dr. Copper. Pastor Montgomery,
Yes, sir.
what's the date and location for you all's meeting?
The date will be April 25th and the 26th. That's the last weekend in April. The location will be the Here Hanana, where Dr. Minor happens to be the pastor. And such classes that we will have will be Technology and Ministry, Brother David Brown, CLS Dean, Dean Patricia Williams, Introducing the Bible, Dr. Ecclesiastes Goodwin, and Level Up Instructors. That's going to look at some of the methodologies and some of the things that we use now in Sunday school, Bible class, as far as teaching. No longer can we just do it the way we did it 50 years ago and expect to advance with our instructors.
Okay. Yes, Dr. Cobb, you have another thing to add?
Yes, I do. I want to make sure if you're in the Far West region, our regional coordinator, Pastor Richmond Johnson, will host a one-day regional conference Saturday, April 5th, 10 a.m. at Mount Zion Baptist Church. And that's 1906 13th Street, Bremerton, Washington. So that's the Far West region. If you're in the area or care to visit, it's April 5th at 10 a.m. at Mount Zion Baptist Church, Pastor Richmond Johnson.
All right, thank you, Dr.
Thank you,
Cobb.
Dr.
All right, Pastor Montgomery, why should people across the Southwest one region and beyond attend?
Well, for various reasons. Number one, because of some of the pastors and the lay people that are working, they don't get an opportunity to come to the national. Our regional conference is closer to the national that you'll be able to get. Also, it's feasible. The registration is only $50 and it's only 2 days. Well, actually, one full day and a day and a half. So you can come in, perhaps, depending on where you live, early that Friday morning or that Thursday evening, and spend a couple of nights and come get great instructors and teaching. And that Saturday around noon, you can head back home. So it does not include a whole week.
Okay. All right. So I know Pastor Montgomery, Dr. Copper, you've given us some quick updates on the remaining regional meetings, and we'll keep updating information on our social media and our webpage. Now, is there anything else, Pastor Montgomery, Dr. Copper, y'all want to share about our regional meetings?
We want you to continue to visit the Hope website, because as our other regional coordinators plan their regional conferences, we want to make sure that you are aware of that and more information is to follow.
Okay. All right. Thank you. Thank you, Pastor Montgomery. Thank you, Dr. Copper. All right. Okay. Sunday, our NBCUSA family observes World Kidney Day. World Kidney Day is a global campaign aimed at raising awareness of the importance of our kidneys. World Kidney Day comes back every year. Across the globe, many hundreds of events take place, from public screenings in Argentina to Zumba marathons in Malaysia. We do it all to create awareness about preventive behaviors, awareness about risk factors, and awareness about how to live with the kidney disease. We do this because we want kidney health for all. All right. And look, we see in the chat that we have some questions. We'll keep coming back to those. We thank everybody that's watching us on social media across our multiple platforms. We do appreciate you all coming and participating. And again, please feel free to share. All right. Another thing about March. March is National Nutrition Month. Yes, we are truly what we eat. This month, let's get to know our food better. Let's work on building the connection with what we eat across all stages of our lives. Learn how nutrients, our nutrient needs, they change with age. Include healthful foods from all food groups. Yes. Focus on balance and sustainable eating habits. And we can also better connect with our food. Learn cooking. Yes, learn cooking. Food preparation. Learn about that. And learn how to plan your meals. You can also explore where your food comes from. And finally, learn about community resources that can be helpful to you, others in your church, family, or community, like SNAP, WIC, and local food banks. All right. Speaking of connecting with food, Sunday, March 16th. Yes, Sunday, March 16th. Sunday, March 16th is NBCUSA Taste Test Sunday. On that Sunday, we encourage our NBCUSA family to prepare healthier desserts and healthy food offerings in their fellowship halls. Each year, we hear from churches all across the country where members were surprised at healthier food choices tasting great, and they were great for them. You may go to our H.O.P.E website to download this year's toolkit. Our H.O.P.E website hadn't changed. It's hopenbc.com. Yes, from our home cooked meals to church fellowship dinners and to our extended family gatherings, food truly connects us. All right, Monday, April 7th. Monday, April 7th. Monday, April 7th is World Health Day. World Health Day 2025 will kick off a year-long campaign on maternal and newborn health. The campaign, titled Healthy Beginnings, Hopeful Futures, will urge governments and the health community to ramp up efforts to end preventable maternal and newborn deaths and to prioritize women's longer-term health and well-being. We're excited tonight. We have a special guest, Dr. Jacqueline Moore. She is a co-lead for the Oak Hill Regional Community Development Corporation Moms Initiative, right there in the great state of Mississippi. Welcome, Dr. Moore.
Thank you.
All right, but Dr. Moore, let's jump into it. Tell us, what is the Moms Initiative?
Moms is a growing regional effort across the state of Mississippi that stands for Maternal Outcomes Made Superb. Maternal Outcomes Made Superb. Understanding that motherhood is a lifetime commitment, Oak Hill will be striving to help mothers and their children make the best possible start. For these families, we are focused on 1, raising the quality of their health care, 2, connecting them with health coverage, and 3, helping them meet social health needs.
All right, Dr. Moore, that sounds very comprehensive. How important is the health of mothers and babies?
Oh, wow. The health of mothers and babies is the foundation of any healthy family as well as communities. It will ensure hopeful futures for every one of us.
Wow. Well, let me see now. When it comes to maternal health, what should be our number one priority?
Our number one priority should be doing all we can do to help every woman and baby survive and thrive. This task is critical Tragically, in America, with one of the most technological advanced medical infrastructures, 22 out of every 100,000 women lose their life during pregnancy or childbirth each year, while almost 6 babies per 1,000 births die in their first year of life. This is a very sad statistic.
My. Well, what can we do to reverse these trends?
Well, we need to listen to our doctors. We need to pay attention to what is going on. We need women and families everywhere to have high quality care support. We need to support them physically and emotionally. And as Sister Bettina said, we need to take care of their mental health before, during, and after birth. Health system must evolve to manage the many health issues that impact maternal health and newborn health. These not only include direct obstetrician complications, but also mental health conditions, non-communicable diseases, and family planning. We need to plan for our families.
All right. Well, what are some things that we can do to support maternal health?
We can keep raising awareness about gaps in maternal and newborn survival, the need to prioritize women's long-term well-being. We need to advocate for effective investments that improve the health of women and babies. We need to encourage collective action to support parents as well as health professionals who provide critical care. And last but not least, we need to provide useful health information relating to pregnancy, childbirth, and the postnatal period.
All right. Well, Dr. Moore, we covered a lot of information in just a few minutes. Is there anything else you wish to share?
I just wish to share that if you are pregnant, go to the doctor during the first trimester as soon as possible, the moment you know you're pregnant, and start getting prenatal care.
All right. Thank you, Dr. Moore, from the Moms Initiative. Okay. All right. I think we've got questions. All right. We'll catch those in our Q&A section. Okay. All right. We'll move on. Wow. There's all this information tonight. Just awesome. American Diabetes Association Alert Day, Thursday, March 27th. Observed annually on the fourth Tuesday in March by the American Diabetes Association. Diabetes Alert Day is a one-day wake-up call that focuses on the seriousness of diabetes and the importance of understanding your risk. Thursday, March 27th, American Diabetes Association Diabetes Alert Day. All right. Remind everyone of our self-paced health ambassador training. We are going through the updating. The basic training material is correct, but we're updating to some couple things in it. They're a little bit dated, but go ahead and get started to receive credit toward health ambassador certification. Email info@hopenbc.com to register. Don't forget to do that. Request a copy of the lesson training guide in the email. Complete the training survey, and that link will be given when you register. And make sure to include in the email subject line NBCUSA Hope Health Ambassador Training. In the subject line, NBCUSA Hope Health Ambassador Training. All right, let's not forget about our March Suggested Health and Wellness Services, National Colorectal Cancer Awareness Month, National Nutrition Month, World Kidney Day, which is March 9th, Taste Test Sunday, which is March 16th, and American Diabetes Association Diabetes Alert Day, March 28th. We remind everyone that Monday, April 7th, is World Health Day. All right. You may download the complete list of our annual health services from our website. Oh, wow. There it goes again. HopeNBC.com. HopeNBC.com. You'll find additional information and resources to some of our toolkits on our webpage. All right. Now, we hope that you'll join us for our first regional meeting this weekend in Shreveport, Louisiana, March 7th and 8th, and join Dr. Copper there and the team. And we look forward to the rest of our cadre of regional meetings. And of course, if you need to know anything or want more information, what do? Email info@hopenbc.com. Woo! We've covered much this evening, but the best part is coming now. I want to hear from you. It's time for our Q&A period. You may type in the chat or raise your virtual hand, and for those watching on social media, we'll do the best to capture your questions. All right, so we're going to open up questions. Look, we have a first off question. So Duke, if you can put our panelists back up, Sister Bettina, Dr. Moore, they can come back up with us. So Sister Bettina, wow. Somebody asked, are there any telltale signs? I know, I probably know the answer already, but are there any telltale signs of people who are in a mental health crisis?
Well, telltale sign. Well, I guess it could be called something else. Yes, you know that if people are sometimes they're sleeping a lot, they're eating a lot, they're acting. They may not be eating at all. They may be just withdrawn into themselves, or sometimes they can be acting out by talking. Not making a lot of sense, but it's crying, so if someone has been going to that just for a few days or even a week or so, it's not an issue. It may be just going through something situational. But if it goes on for a long period of time, with being withdrawn, being angry, oversleeping a lot, eating a lot, you may want to start having a conversation with them.
Okay. All right. Dr.
Those are just some signs. There are others, but those are some signs.
All right. Dr. Moore, Smash said that church has baby showers or host baby showers. Is there anything that maybe folks they could do at the baby shower to really promote, I guess, other than give them kind of gifts and stuff, to promote this whole idea about healthy outcomes for maternal health for the baby?
Yes, sir. I would think baby showers are based for fun, but we could also have an information session. You can always invite your local health nurse to talk about maternal issues that might be going on for someone who's not going to the doctor. Or you can also include a nutritionist to talk about how you should eat. So you could have a 15-minute session just for information there. We do it at the baby showers that we're going to host. We're going to have speakers, and one is going to be on mental health. Even though we're having fun, somebody needs to cover the mental health part.
Okay. All right. And Sister Blakely asked about learn about health foods. I put in an answer to her question directly, and I'm also putting in the chat the website. It's a great website where we use our information background from National Nutrition Month, and they give you information about where things are. And look, I can say the thing, y'all probably get sick and tired of me saying the same thing over and over again, is that they always talk about the fact that grandmama and them ate all that bad food and they lived to be 9,700. But as I always let them know, when they ate all that bad food and went out in the cotton field or whatever,
they worked it off.
They worked it off. So, hey, I got the tail end of it, so I can testify. They'll work that. All right, Sister Combs, we are bringing back the mental health training and certification. We're just waiting. We're waiting. We got to get a couple things in place. We hope to make an announcement probably in the next a couple of months, and we will bring that back. And we will once again have our mental health first aid training. When we have it, we will post it on our Hope webpage, and we are keeping up with emails of the people who participate, and we'll get that out. We've been having a lot of requests, and we're ramping up so that we can be able to offer that mental health first aid training. Thank you for that question. All right. Okay. This is Bettina. Wow. they said, what can we? That's kind of crazy. Crazy thing is, but what can we do to break the superwoman? Uh,
Syndrome.
yeah, make the
Syndrome.
for black women the superwoman paradigm is what he's saying. What can
Yeah.
we do? That's a correct, but
Well, each one of us have to start with ourselves. And one of the things that I learned a long time ago about ask yourself why you're doing what you're doing.
okay.
If you are trying to help someone because it's something that you want to do, then do it. But if you're trying to help someone because you think if you're showing them how you want to be treated, how you want to be loved, and that they in turn are going to do that, forget it.
Don't do it.
Because they're going to take everything that you have to give. And when you get tired of giving, they're going to go on about their business. So that's one way that you can look at it. I mean, when you get on an airplane, the first thing when they start talking to you about safety, the first thing they say is secure your mask first before you can help anybody else. So breaking that superwoman syndrome is not allowing people to guilt you into, and people include you, to guilt you into believing that you need to do all of these things. You have to start with just one thing. Start with just one thing, and stop knowing that one thing. It'll seem because most people, women are so we're natural givers, we're natural helpers. But sometimes, people get themselves into situations and then they want you to bail them out. Maybe you need to just learn that they need to learn how to bail themselves out.
Learn to say no.
Okay. And learn to say no. Thank you, Dr. Jacqueline. Learn to say no. Make that your motto. Learn to say no. And then learn to say, I know me and I love me. I accept me. I like me. I forgive me. God lives within me. Me being the key. And then go on and forgive yourself all of them things you don't do that you think you should do.
All right. So Karen White was ahead of her time when she came out with that song back in the day, Superwoman. Okay. All right.
But I think it was Gladys Knight that came out with the others that I'm not your superwoman.
Okay. All right. We're stirring it up on tonight. Okay. All right. So, Dr. Jacqueline, that said, how can we get fathers? How can we get fathers involved more? I guess it's more looking at the fact of a lot of single moms in their process, and I'm assuming that they're probably looking at more in the pregnancy and then immediately afterward. That's what I'm gonna add that to that.
For one, you can invite him to the doctor's appointments. Invite him. He needs to come and go. He needs to hear. And if you're having some mental issues, you need to rub your feet and listen to you. It's not just about carrying the baby. It's about us being a family.
Okay. Wow. Rubbing the feet about being a family. That's something to hear on that. Okay. About Taste Test Sunday. Yes, that we do have a toolkit on our website. You go to and download it. It's got information that you can put on in your worship guide for that Sunday. And of course, love to see some pictures that you send to us, or we can post and share it. At our church, we were already making plans for our Taste Test Sunday on the third Sunday in March. And I'm going to do, a lot of people like to eat pulled pork, but I'm actually doing a dish of pulled chicken. And the folks in the church say when they eat it and whatnot, it's just delicious. They can't tell the difference between the two. So that's
Dr. Manna, can I add something?
Yes.
And I want to say to young women, before we make men's babies daddies, let's ask them, do they want to be a baby daddy?
Okay. After they want to be a baby daddy. Okay.
That's one of the key things. Just going to get pregnant just because you're trying to hang on to him doesn't make him a baby daddy. So have a conversation before.
Okay.
Ask him how he feel about children.
Okay.
All right. Ask him how many you already got.
And is he taking care of those? Oh, sorry.
Thank you.
All right. Wow. We're in the mix tonight. Okay. So
didn't I say something, Pastor? Dr. Jacqueline, you talked about when you were talking about pregnancy and pre-planning and all of that. You talked about the fact that you mentioned sexually transmitted infections. So I just want to say that when you get pregnant and you continue to have relationships with someone that you know is not being faithful to you, take the steps that you need to take to protect yourself and your baby.
Right.
Yes.
It's problematic in the world. In the world that we.
And if you don't know what it is, call Dr. Jackie. She'll tell you.
I'll tell you.
All right. All right. The world that we live in. All right. So now this thing I'm talking about. Oh wow. For our pastors, I already know things about the nutrition thing. Yes, our pastors should be good examples for healthy eating. But oftentimes our pastors are the worst examples of healthy eating. Yes, they ought to be. But what you can help your pastor, she brought that up. You can help your pastor by not preparing a preacher plate. And I've always said this, and I've always been amazed at a preacher plate. The biggest piece of chicken and the biggest, macaroni, like macaroni and cheese and all this stuff. And if they cook 7 desserts, they line them all up there because pastor got to taste something from everybody and everything. So you can help your pastor, him or her, by going lighter on that preacher plate. Because I had one preacher told me, he said, man, I got to eat some each one of them desserts. I don't want none of them women to be mad at me because they'll go back and say, I need that dessert. So, just take it, but we can be our own worst enemy. Own worst enemy when it comes to our pastors. Oh, that is something. But it's so true. It's so true. Dr. Jacqueline, ask what role do grandmothers and great grandmothers play in this whole thing about maternal health for them?
Speaking from experience with my mom, she was there from day one. Grandmothers, great grandmothers have a lot of knowledge. Listen to them. When they talk about the sun and the moon and when your baby's going to come, they're normally right. Wisdom comes with age. So stay close to them and listen to what they have to tell you. And if they tell you to leave that man alone before you get pregnant, leave him alone.
Okay. All right. All right. Y'all heard that first up. So, Sister Bettina, they're asking now for Black women. I know it's with our emphasis on it. So they're asking, are there some things that Black men, the wives should be concerned about for Black men and their mental health? I guess the only thing is that we talked a lot about Black women. I guess you see a few things when it comes to Black men as well.
Well, I would say the same applies to Black men in terms of watching, them understanding what's going on with them. Your husband, if he's a person that talks all the time and is always joking and stuff, and all of a sudden he stops doing that, something goes through something, he stops doing it, he starts withdrawing from you, he's not eating, not sleeping, something, it may be something situational that he's going through, and so you try to get him to talk to you. And if he won't talk to you, encourage him to go talk to the pastor. If there's no pastor in the picture, encourage him to go talk to his doctor, talk to his best friend, talk to someone that's going to allow him to be able to say what's going on so that you can get him the help that he needs.
Okay.
So him or her, the help that they need.
All right. And on that note, Sister Bettina, men will tell you, I'm not in a good headspace. Just don't laugh it off.
Yes. Don't
listen to them. When they say I'm not in a good headspace right now, listen to that. That's the key.
Listen to it, but even gently probe to try to get them to tell you what's going on. And if they don't, then you watch them for a while. And if that continues, then you strongly suggest that they find someone to talk to that they can talk to.
Okay. All right. Well, I think we have another question, but I will say that one thing that we know in our area, we have some congregations that deal with a lot of bereavement. I think it's one thing in the Black church we have to really have more discussion about and dealing with that. And that may be a whole nother webinar we have in itself. But look, that reminds me. Look, let me take a moment of personal privilege, and I want us to lift up one of our most enthusiastic NBCUSA Hope supporters, Dr. Clifford Jones. His wife made his transition First Lady, Sister Brenda Jones, C. Brenda Jones, and the funeral is going to be this week. And he is just such a good, strong supporter of us. And speaking of things about bereavement, we all can lift each other up in prayers, especially when you're a pastor. Pastors have to be strong for everybody else when they're in bereavement. Then when pastor has bereavement, it's just another thing. So we want to lift him up. And as we do that, we want to just think of all the other pastors going through as well. But look, Sister Patina, Dr. Jacqueline, is always great. We're going to come back after we wrap up and go offline if anybody has any other questions or comments. But just wonderful from the great state of Mississippi. Who says and not some wonderful things happening in the Magnolia States? Thank you all again. All right. Now look, y'all, for upcoming, hope y'all join us. Our first regional meeting is coming up again, March 7th and 8th there in Shreveport, Louisiana. Okay. And again, if you need information about anything, just go to where? Hope. Info at hopenbc.com, or go to hopenbc.com, and you'll find that information. As I tell folks all the time, if you don't know where to go or don't know anything else, just start info at hopenbc.com and you're good to go. All right. Thanks again for all your thoughtful questions and comments. Now, the agenda for our next call, April 8, 2025, we've been Minority Health Month, Alcohol Awareness Month, and we'll talk some things about the Summer Vacation Bible School, how we can infuse health and wellness in our Vacation Bible School. So that will be on our next TempleCare webinar. And the next TempleCare webinar will be, April? It'll be April 1st. April 1st. It'll be Tuesday, April 1st, our next webinar. Again, you may join us on the web and social media. Again, our webpage is hopenbc.com. Our Facebook page is National Baptist Convention USA Incorporated Hope Health Initiative. We're on YouTube channel and NBCUSA Hope. And if you want to have an in-person training for our health ambassador, you can again info at hopenbc.com, or you can call 901-603-0762. That's 901-603-0762, and we can make that happen. Now, we appreciate your feedback. We'd like you to kindly complete our webinar survey. We paste the link in the chat. And the biggest room there is the room for improvement. All right. We appreciate the tireless work of our entire NBCUSA Hope team. Yours truly, Dr. Michael O. Minor, Dr. Desi Levy, Sister Lydia Minor, Sister Nettie Johnson, Pastor Dexter Moraney, Sister Ellen McKnight Hill, Dr. Felisa Washington, Mr. Geraldine Moore, Sister Loretta Miller, Dr. Lavora Williams, Sister Bettina Campbell, Dr. Marion Talley, Brother Thomas Duke Robinson, who's our technology moderator on this evening, and of course our 7 regional coordinators, Pastor Daniel Blackburn, Northeast, Sister Brooklyn Rogers, Southeast, Pastor Bernard Montgomery, Southwest 1, Dr. Linda Copper, Southwest 2, Sister Teresa Fels Farr, Midwest, Sister Farrah Robinson, West, Pastor Richmond Johnson, Far West. To connect with your regional coordinator, you know what to do. Just email info@hopenbc.com. We know that some of you have additional questions or comments that are watching us on Zoom, so we'll formally close this evening's webinar in just a moment. For those joining us via Zoom, we'll open your mics up for additional session feedback. We hope you'll see us on our next call, which will be, look at the calendar, Tuesday, April 1st, 2025, for our next TempleCare Matters webinar. Finally, we acknowledge our president, Dr. Boise Kimber. He reminds us that we are changing the course, not our conviction. The gospel still works. This is a production of the National Baptist Convention USA Incorporated, the nation's largest black denomination. God bless you and God keep you is our prayer.